I'm Dr. Hilary Hines, your training officer. Welcome to part 2 of our appointment series, which is going to be called Patient Appointment Status Management. So currently we're at our appointment ledger, and how we know is that appointment ledger is in our title bar. Now, we're going to see how we can let everybody in the clinic know the status of Owen Morgan as he goes through his clinic date. So most patients have a process when they go to the hospital or when they go to get any particular service in an outpatient clinic. Usually they meet somebody who marks them as arrived. Then they may or may not get some vital signs done. And then they go to see their consulting specialist, who could be a doctor, a nurse, a physiotherapist, a psychologist, a nutritionist, etc. After that, they leave, they get their follow-up appointment, and they go home. System 1 has a way of helping you to mark which patients are at each step. So how many patients are here, just arrived? How many patients are waiting to see the consulting specialist? How many patients are actively being seen by the consulting specialist? And how many patients have been finished and have left the clinic? I'm going to show you how to do that now. So let's look at Owen Morgan under the practice rota. Your rota might look a bit different from mine, and that's okay. When I right click on Owen Morgan's name, I get a drop down with a bunch of options. And in my second row, I see 4 options that I want you to focus on. So the first is arrived. So that lets you know that Owen is here. The second is waiting, and it has an hourglass. It lets you know that Owen is waiting to see the consulting specialist. The third is in progress, which has a door and an arrow going into it, which lets you know that Owen is currently being seen by the consulting specialist. And then we have finished, which lets you know that Owen is finished. You can actually set the patient to each of these different statuses and let everybody in the clinic know where they are at. So let's mark him as arrived. I'm going to left click on arrived. And as you can see, his color has changed. You can see that there's also an icon that looks like an orange clock. And you can see a number beside his name, which is his place in the queue. We'll talk more about queues at another time, but for now I want to focus on the color change. Some of us may not be able to see colors so well. Some of us may not remember what the color means or what the icon means. That's fine. Because if you just move your mouse over Owen's name, you get a drop down that can tell you where he's at in the process. So if you look at the second row, it says appointment arrived at 1800 hours. So that means he arrived at X time and he's been waiting for 1 minute. So as you can see as well, these particular moments are time stamped. I, as a nurse, may want to do some vitals for Owen. I don't need Owen's physical record to record vitals for him anymore. In fact, I can even pull his record from the appointment ledger screen. And let me show you how I do that. When I right click on Owen or Morgan's name, I'm going to go down to the option that says view record. It's closest to the bottom of the drop down and select view record. Then it will open his record and I'll know that I'm in because I see patient record in the title bar and I also see his name on the upper right hand corner. Now in my clinical tree, I'll be looking for a template that says OPD landing page. Some of you might have more customizable landing pages depending on how your clinic runs, but this is our generic example for the purpose of training. So in my OPD landing page, I can see that I have the option to update vitals and input-output charting. I'm going to left click to select that option and I'm going to put in a blood pressure. When I finish, I'm going to select OK. And now I want to let the consulting specialist know that Owen is waiting to see them. There's a green button on my landing page and I can left click on that button and I can mark him as waiting and click OK. Now I need to make sure that I save whatever I've done in Owen's record so that the consulting specialist can see whatever I documented. So I'm going to click save which is going to save my information as well as close this record completely. When I click save, now you see that Owen's name is orange with an hourglass icon. That means that he's ready to be seen by the consulting specialist. But if I can't remember what it means, I can always put my mouse over his name and I can see what his status is as well. So as a consulting specialist, I now see that Owen is ready to be seen by me because his color status has changed and we have an hourglass icon. I can pull his record from the ledger too, but I want to make sure that people know that I'm claiming Owen. So I'm going to right click on Owen's name and select in progress. When I choose in progress, his color is going to change again, and we're going to have an icon change with an arrow going in. That lets everybody know that Owen is being seen by me, so please don't try to take him. Then I'm going to right click on his name, select view record to open his record. As you can see, we have his name in the right hand corner of the screen and the name patient record is in our title bar. I'm going to go to my clinical tree and go to the same OPD landing page. And I'm going to decide if I'm going to write a new patient note for him, meaning for our first time visit, or if it's a follow-up note, aka a SOAP note. So I'm going to do a short SOAP note for my patient. Here I can see the last documentation that a nurse has made, and I see on the 28th of March, his diastolic was 60 and his systolic was 110, and who it was done by. That looks fine to me, so I'm going to put my subjective as fine. I'm going to write some objective notes. For the purpose of speed, I will be using my preset notes, which will tell you a little bit about in a different video. My assessment is that he's fine, and my plan is to see again in 6 months. I know that you write more detailed notes, but this is for the purpose of our training video. I'm going to click OK, and I want to let everybody know that he's finished and can be seen by health workers to get his next follow-up appointment. So I'm going to use the same green button that I was telling you about before. Select update appointment status and change his status to finished. Now I have to make sure I click save in order for everyone to see the information I've entered into his record. So I will select save, and when I go to his ledger, I can see that his status has changed to a darker purple and there's an arrow going out. Now, as I said, it might be hard for you to remember the colors and icons, so I have moved my mouse over his name, and you can see under appointment the time he arrived, the time he was seen, and the time he was finished. And that is the basics of how you manage patient flows in your clinic. Now, I understand that some clinics might operate differently. These are the basics, and you can modify these statuses to reflect how your particular clinic runs. We actually have support staff that will also assist you in that process as well when the system is finally in place in your specific hospital or department. Thank you so much for watching.